Good morning.
How are you?
Great and yourself?
Sleepy
Uh
again.
oh.
Yeah, I was in them streets last night, so
Uh-oh.
I know. I have to say, you're not 21, ma'am. You're not. And I actually came home like at midnight. But since I'm used to being in the bed by 8:30, 9 o'clock, that
Oh
was that was
yeah.
a stretch. That was a stretch. How was your week?
It was it seemed like it went by pretty quickly, like after Tuesday.
Yeah, that break in the middle was weird, but yeah. But welcomed. I welcomed it all. Any break I can get. Good morning, Tanika.
Well
Good
no, you
morning.
had a break, I didn't.
Wait. Where is my tea? Look, I felt all of that. We starting off early.
Yeah. Some of us still work for the man.
I'm sorry. She was like, I didn't either. I'm sorry. Oh, my bad. See, I'm making assumptions that we all are celebrating or celebrated Juneteenth and got the day. I bet you got the fourth. You get the fourth off though, won't you?
Oh yeah.
Okay. Yeah. Well, I know. I've heard certain companies allow it as like a floating holiday, so you can flip it with something else. But like you flip it with like Martin Luther King Day. Like, come on, y'all. Like,
And and that's what I'll use every year as my floating holiday.
kill it. Okay. Well, I see some well, and then I thought it was a national holiday, but then I heard somebody say not all states recognize it. So you got that too. I said, "Well, really? Well, what?" Well,
But see, but th- I know this was not the intention of the
no.
family, but this is why these kinds of gestures are performative.
mm,
Because if you're going to think that you're doing something, and by recognizing the day as a federal holiday, it should be a paid day off.
it should be a payday
So
off for
if
everybody,
it's not,
period.
then all you did was just sold some people a bill of goods.
Right. And everybody like, rah, I'm like, because people were still celebrating it. They didn't need your
Right.
additional whatever. Those who celebrate June, and we're talking about Juneteenth, those who celebrate had all the things going on. Texas was live every year prior to all of this. So, really?
Exactly.
Oh my goodness. Oh my goodness. Good morning, Carolyn. Good morning.
Good morning.
Okay. Well, I didn't mean to rile y'all up. My bad. Just at good morning. Well, anyway, welcome to the Saturday morning tea where we do all of these things. Let me get to my script. Okay, where we discuss health information, news, education, certification tips, federal holidays. What did you call it? A performative gesture?
Mm-hmm.
That says enough. Look, okay, I'm going off script again. My kids used to say, anytime I said, somebody was in trouble. So they knew we had our own special language in my house. They knew it was going down. Anyway, we discuss all of those things and entrepreneurship, really, primarily the revenue cycle at large. So as you come in, don't forget to hit the thumbs up or like button. I'm Clarice Warner. I'm the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. So let me ask you, yes, you personally, do you know what it takes to be a certified marketable, let me stress that again, marketable medical coder? Well, before I introduce my co host, let me share with you 5 steps to become a certified marketable medical coder. I'm going to share with you a free email course that will provide you all of the information on becoming a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Okay, that was a little pick me up. I feel it. I'm coming back. So if you are interested in getting more information on the 5 steps to become a certified marketable medical coder, then check out the video link for, or check out the video description for the link. Get it together, girl. See? Lost it just that quick. All right. So join me today. I was out in the garden. I've been out in the heat already. I was in my garden, watering stuff, and I got a little okra. I was so excited. It's so cute. I've never grown okra before, so that was cute. And picking my greens, and I was doing all the things before the Saturday morning tea. So now I need a nap because it's hot. It's like 80 degrees at 8 o'clock. Well, I was out there at 6:30 in the morning, but it's too hot to be outside. But anyway.
Wow.
So the heat has probably fried my brain a little bit. But anyway, joining me today is my co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I have been in healthcare for over 30 years. I transitioned away from the bedside in 2014 into HIM, and during the pandemic in 2020, I created a company called the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
And how is that going for you?
So far, so good.
I saw all your stuff last week. I said, "Oh, he
Finally, yeah.
he's coming, he's coming." Oh, ma'am, wait a minute. She said that's why them squirrels be after you, garden. Wait a minute. Let me tell you something about my garden. I have a whole fortress. I have all, so they don't get to my stuff. I learned that first year when them squirrels was biting on my tomatoes, and like they'll take a bite out of it and leave it like nah,
Exactly.
what you gonna do? And I went ballistic. So from then on, I had to show, I'll bring some pictures next week or put up some pictures. I built a whole little um kind of makeshift garden shed thing out of PVC pipe, and then I wrapped it with the bird netting thing so nothing can get in there. You may see little butterflies and little stuff like that, but nothing else can get in there. And then it's anchored down to the ground, and I did all the things. So squirrels, while they are a plethora out there in my yard, and they seem to love to sunbathe on my deck, they not messing with my food. No, I will hurt a squirrel. After they broke my whole heart, and I was like, it's one thing to take the tomato, take it back to wherever you live and feed your family and do your thing. It's a whole other thing to take it after it takes 80 days for a tomato to grow and bite it and then leave it. Oh, I was I wanted to fight. Do you hear me? Carolyn said, "Don't hurt them little squirrels, girl." Oh, they just trying to get a snack. Snack somewhere else. Don't snack
There
here.
you go.
Don't snack here, and snack here for free. What? Oh Lord. Okay. So remember, we are here providing topics, and this is a conversation. So we want to remind you that you can join in and add to the conversation as you see fit. So don't be shy. Come on in. Let us know. Say hey. Put up a teacup. Let us know you're here. You can tell us where you're from, and you can give us your opinions as well as your experiences, particularly with this topic today. I am so curious to know if anybody has any experiences with our topic. So use the chat. Talk to us. We'll talk back. I think that's a song too. I feel that in my spirit. Anyway, if you have a question, the only thing I ask is that you type a Q first so we know that it's an actual question and we don't miss it in all of our back and forth banter and chat. Okay? All righty. So for today, for those who are just joining us or watching the replay, again, welcome, welcome, welcome. Today, we are talking Florida's patient data lockdown. Health information pros, take notes. but first, let's get into our church announcements. Shall we? Yes, we shall. Yes, yes, yes. I feel like just marching. There we go. There we go. I haven't played back on AI to see additional. I need a whole day. I need 2 days of just nothing but marching. Get it creative. All right, all right. So church announcement. I don't know if you all have seen this, and Mr. Jesse, I know you talked about it before, but the OIG, they have been OIGing again, and I'm seeing an uptick on COVID-19 cases. So I don't know if it's specifically what we've been waiting for, but they are kind of poking around and poking the bear around things COVID-19, and some of the stuff is just, I don't know if these new providers, I don't know, they just thought they was gonna get over. I don't know, but folks, I don't know. Folks just out here in these streets wilding out. Were you gonna say something? Like you was gonna say
No.
something? I'm like, I don't understand. So I've seen a couple of these, like I said, from the OIG. Something came in my I think something came in my email that was specifically for them. But while I look for that, let me remind you of our we got a whole celebrity with us, don't we? Let me remind you of the Black Women Cultivating Change presents Breaking the Silence, a Black nursing documentary that's going to be showing in Philadelphia, Pennsylvania. Yay! With one of the co-sponsors, our very own, the Coding Nurse. Love it, love it, love it. On August the 2nd from 6 to 9 p.m. Do they have a price? I don't see a price on here. Is there a fee? Do you know?
I want to say $25
Okay.
per ticket.
Tickets are $25. I think they don't even have more information. Do y'all got another flyers? Who do they contact you?
I could get in touch with her.
Okay. So for more information, contact our very own the Coding Nurse, and he can put you in touch with the folks that you need to contact. Oh. Yay. They were just letting the test go through, especially the combo COVID, ABD, flu, and flu A and B tests. They got them wrong now. Yeah, it's a mess. It is a mess. Somebody wants to know, do we need to purchase ahead or at the door?
From what I understand, you can purchase ahead, but I'll talk to Raquel because maybe she could just set up a little landing page for people to get tickets who aren't.
Yeah, if y'all get some more information, definitely, or you have another flyer or something that has that information, right, just let me know. I'll make sure to put that there. Yeah. So I was supposed to have been looking. Y'all done got me all off guard, discombobulated, and all of the things. Mr. Jesse, did you have any church announcements?
No, not this week.
It was kind of a light week. Oh,
That
and it's
was
the other thing I saw, a lot of hospice stuff. Like, woo. Yeah. So there was the woman pled guilty to COVID testing. Um, so she had a whole vaccine um card fraud scheme. So, remember there was a time where or healthcare organizations and other employers, and other people, just for all of the things, you couldn't be a part of, you couldn't be employed by, you couldn't do anything without a valid um, uh, card that said, did you have received vaccinations? Well, this lady, um, she destroyed vaccines and then issued a corresponding number of the fraudulent COVID vaccine record cards. So she got the vaccines, didn't give them to the people. She ain't put nothing in nobody's arm. She destroyed it, but got the information and put, if when you have your card, they have all the information about the vaccine. And so she was giving away these cards. I, I'm sure she probably got some uh, coins as a result of these cards, but yeah, but she got caught. And
Does it say how?
it
'Cause
said,
I would love to know.
let's see. It says, according to court documents, Kathleen Brialt, 66, of Cambridge, a midwife at Sage Femme Midwifery PLLC, an authorized COVID 19 vaccine administration site in Albany, New York, conspired to obstruct the government's distribution of COVID 19 vaccines by providing COVID 19 vaccination record cards to individuals who were not vaccinated, including to minors who were at the time ineligible to be vaccinated, and to Canadian citizens who were not present in the U.S. when they were purportedly vaccinated. In addition to destroying the COVID 19 vaccines and issuing fraudulent vaccination record cards, um, Brialt and her co conspirators made over 2,600 false entries into a New York State database that tracked COVID 19 vaccine distribution. Brialt agreed to pay more than $37,000 in restitution for the destroyed vaccine. She pled guilty to conspiring to defraud the United States and its departments and agencies. She is scheduled to be sentenced on September 18th and faces a maximum penalty of 5 years in prison. A federal district court judge will determine any sentence after considering the U.S. sentencing guidelines and other statutory factors. I don't know if it's still going on. It talked about all the people who was involved. Da, 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 da. That's all they gave.
Oh,
So probably, I mean, if she was putting the stuff in a database, like she was doing a
because
lot,
no,
and her
because
co-conspirators.
because honestly, like if you're going to, I don't know, it could seem like she was doing everything right because it wasn't like they were still finding all of the vaccines. It was appropriate dosing. She was just destroying it. Somebody had to tell some kind of way.
Mm. Well, they made note about people, Canadian citizens who were not present in the United States when they were purportedly vaccinated. So there's a kink there.
Right.
Um, uh, Interesting.
I mean, because a lot of people did that.
They
Gave
did.
out. I mean, I'm talking gave out false vaccination cards.
And I guess they'll be coming for them too. If they wasn't as savvy as some others. I don't know. But yeah, I don't know.
Wow.
I know. But they're coming. That was just one of them. Um and I've seen a couple other little things, but they just out here wilding though. Um and for whatever, and I guess I don't know, Medicaid must have up their enforcement game, because it's a lot of Medicaid stuff happening too. um, out here in these streets. I don't know, just a lot. Like they came out. It's like six different little things and some additional fraud alert. Oh, something about grants. There's a whole fraud alert. Um, Scammers are posing as HHS officials offering fake grants. These fraudsters aim to steal your personal and financial information. HHS will never request your bank account or social security number over the phone. Stay vigilant and informed. Yes, 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 yes. Well, you got to be on a swivel, don't you? At all times.
You do.
At all times. Okay. Hey, stop sharing that. Alrighty. So today, I want to talk a little bit about uh we talked a little well, we started this conversation last week, I guess, a little bit, talking about offshoring. So let us spill the tea, shall we? All right. So Florida has a law that went into effect last year. Pretty much, it's been about a year. Well, I think it was in July of 2023. So it's coming up upon a year. So I'm really, really, really interested. And I could not find um, any concrete data to tell me how is it going. It's one thing to have everything, but how is it really, really going? So they have a whole law um, in Florida about um, offshoring, and it prohibits the offshoring of patient information. So the way she said, not too much on Florida. It prohibits offshoring of the actual information, and what they're suggesting, or what their law states, and what you have to do. Let me get this out of here because this is driving me crazy. Okay. What you have to do is and let me start by, Florida is not the only state that has a similar kind of law. There are several states that are from years ago that require certain parameters around offshoring, but none as specific as Florida's as it relates to patient information. So, what they're saying is that you can't have the all patient data must be physically stored in the continental United States or US territories or Canada, and there's no exceptions to that. So you can't send stuff, or the patient data can't be physically located in another country. One of the reasons why this is was interesting to me is because that there are several organizations and trends that are contrary to that. They want to send their whole departments offshore. So it's not just we're thinking it's just certain tasks, like, okay, well, like they did with transcription. Let's send transcription off, or let's send call centers, or they want to send like that whole revenue cycle entity offshore. Um Including the records, the documentation, and all of the things. And Florida was like, wait a second. No, 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 no. So who's affected by this? All healthcare providers in Florida that are using certified electronic health record technology, or I'm a I'm gonna think that says CERT, CEHRT. I'm gonna call it CERT. If it's something else, you Florida people can correct me. So this would include doctors, pharmacists, hospitals, and even some mental health facilities. So all of these folks, um, you can get it. You can be part of the problem or the enforcement if you are using this technology. Now, again, the whole thing is that um, your patient data has to be physically stored in the U.S. territories and Canada. Canada confused me. I know, and I don't know. I don't think HIPAA extends to Canada, so that confused me. I was thinking this could be kind of a HIPAA type of regulation, but maybe not. Again, because Canada threw me. um, so providers will have to attest under penalty of perjury that they're following these rules. The state's healthcare administration agency will be watching, and non-compliance could mean disciplinary action. Again, I would love to know um, what the trends are as it relates to compliance on this particular rule as we are approaching the 1 year of this. So, some things to kind of look for is, or what these companies need, especially those um, that are actually growing in interest in offshoring. So you have the states who are putting or trying to, because the feds seem to be real silent, but you got the states who are like, well, since they're not doing anything, let us get more. I wonder if there's some city laws too, because then they can be even stricter. But nevertheless, the states are now taking the mantle, like, well, with the feds being silent, let us do it. Um, I guess one of the things that I immediately thought of is that maybe folks will then just start their businesses in states that don't have these type of restrictions. I guess I don't know, but you know how folks like to move around and start their businesses in Delaware. I think that was one of the more popular states that people like to start their business for various reasons. So this may be, I guess, an opportunity for those types of things to happen as well. But some of the suggestions were to assess where the data is currently stored, work with IT to ensure compliant storage solutions, update all policies and procedures, of course, train your staff on the new requirements, um, and prepare for potential audits. But again, while Florida is and other states are like, slow down. We offshoring. No, we don't want to have anything to do with any of that. Other health systems are like, wait a minute, we're having problems. And so they're, like I said, they're considering shipping their whole back office functions overseas to cut costs. And we talked about that last week, where it's really um, a cost saving measure for most of these organizations. The thing that gets me is you got folks who you have consulting companies, and I linked the articles, one from think I think both of these. Well, one comes from an attorney, one comes from a consulting company that are fan names both ways, and um, getting folks, one, providing awareness, but then trying to it's advertisement, really. It's a way to say, okay, well, here's what's happening, but we can help make sure that you are compliant. And I saw so many offshoring advertisements, even from companies in the Philippines. I think the Philippines seem to be hot and heavy now, or they're trying to be the top group to get a lot of um, revenue cycle staff, and how trained they are, and so on and so forth. So again, this was just some information about this particular law. Um, you also have, which makes this kind of easy, because certain systems, instead of having kind of a revenue cycle in this state for this system, for this hospital, and I'm speaking of large hospital systems, they are centralizing it, or have standardized and centralized in most cases these process. Some of them are outsourcing, and that means that they are providing, another company is actually providing that particular, and I'll just use revenue cycle, providing that revenue cycle service for that large organization. And because it's standardized, it's kind of an easier transition for that. Well, now they're taking this to the next level, and because it's streamlined and standardized, then the opportunity to offshore makes it kind of attractive to those hospital systems who feel like they're losing money or but that kind of thing. So, or the dollars are not adding up and it's not making sense and all of the things. The one article said or asked the question why the interest in offshoring, and they said hospitals are facing significant financial pressures. Um, in this particular article, the Deloitte article, 70% of hospital CFOs are more concerned about the economic situation than a year ago, and that was a year ago, so it's probably even more dire, with over half worried about operating costs. And so, again, they're plugging this and pushing this as a way to offer cost savings. It says, for example, a large health system might spend $50 million annually on finance and accounting functions. Offshoring could potentially cut that in half. But then they say it's just not about the cost. It can also provide access. This this is where my eyebrow went up. Access to talent, scalability, and even opportunities for automation and process improvement. Again, that opens the door also for AI. So you got, like I said, we're feeling it, or will be feeling it on both ends, really. But there are risks that they need to consider, including loss of control, potential quality issues, regulatory challenges, and the complexities of change management. So we're here in health information, and this is something that kind of we need to follow, especially in your state. If you have a state that either has such a law or is proposing such a law, and what that means for us in the health information field. Yeah, Mr. Jesse.
All right. Yeah. So
I'm just bringing the information, sir. Let me sit
no, no,
back and
no,
grab my
no,
tea.
because this doesn't really, no, it doesn't really do anything because they're talking about the physical storage of data. Who cares? Okay, if you want to store it here, that's fine. That has, and just like to Carolyn's point, that has nothing to do with people in the Philippines logging into 3M and Epic and reviewing the information and doing it. Like that doesn't stop offshoring in the way that people in HIM need offshoring to stop.
Mm-hmm.
Like that's just talk. This is just talking about physical storage, which is, I mean, okay, if you want to, that's nice, but that's not going to stop them from going to the Philippines, going to India, finding these people who are going to work for 25, 30% less
Half.
than what exactly than what we will, work for over here. So, I mean, I understand the medical right, the storage piece, but that doesn't stop the function.
And I saw somebody's um uh this was an outsourcing company that I believe also offshores. Um, but they were talking about how they can, manage and work on claims 24 hours a day. Da 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 da. We're coding 24 hours a day, so we're always, getting things moving. Our system never stops. Stop. And I'm like, really? She said they can take screenshots overseas, ma'am. um, and you're right. That's why I said I would be interested. One, to know if anybody had any experience with any of this in a state that has this type of law or restriction. But two, like, and I mean, it's a start. It's somewhere to kind of begin, but so we all know some of these uh think of your big lobbyists. We talked about the AMA, the American Medical Association, American Hospital Association. Think of all of these big organizations and the lobbying that they do at both the state and federal level. Um, and yeah, they want to lock arms and be proponents with others, but they have their own interests, and oftentimes the interest is financial. And while yes, it looks great to have a kumbaya at the table, everybody at the table, we're all working for the good of the patient, da 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 da. It's at the end of the day, it's a business. And the bottom line is what's keeping this business afloat. So if there is a way to cut um and in their minds produce more, because if you're cutting these salaries or and offshoring, to Mr. Jesse's point, to these companies and staff that will accept way less, they don't have to worry about any of that overhead and all of those things. um to a CFO, all of that looks and sounds good. Like, there's nothing that's really deterring them from saying, you know what, that's not a good idea. Let's do da 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 da. Um, I read somewhere too that they were talking about, um, because we all know that HIPAA doesn't extend out into these companies and organizations, but um, these organizations need to also still have a BAA sign and be the keepers of all things HIPAA privacy with these companies and organizations that they contract with. And I'm like, all of that sounds really, really, really good, but hell, they can't keep HIPAA straight here in the U.S. I mean, we see all of these breaches, we see all of the things that happen, and not just, now that we have electronic stuff. I mean, breaches been happening for forever, for decades. Pre electronic medical records, folks been talking and talking and talking and telling the business. So, those things have just been going on for years. So, I don't know. I appreciate the effort, I guess, of trying to do, but and the reason why I said all of the things about the organizations and lobbyists is because, they're the ones that kind of go to these politicians, our elected officials, and be like, yeah, if you want to continue to get our funding and da 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 da, you may want to vote this way, or you may want to consider da da da, or whatever, whatever. And so, just like Juneteenth, here's a little something, something to dangle a carrot to at least get folks to think that, okay, well, we are thinking about it and we're serious, but really, where's the teeth? Just having them sign off, that's like a claim, for every provider that submits a claim for services. There's a disclaimer that says that primarily you are responsible for the accuracy and completeness of this claim, da 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 da. Okay, so with and electronically you have signed off on that when you submit that claim. Well, having this same document saying that you will keep your patient data stored physically is great. Look how many people on fraud and abuse that we see on a regular basis just on claims. I mean, I don't know. I don't know. Your face is killing me. That's all I got right here.
I'm just not. It doesn't help us. It doesn't.
And again, I think there needs to be some stricter something. But this was the first, well, one of the ones that I saw that specifically talked patient information. Um, Most of the other ones were around having a state contract. So if you are a contractor with a particular state, there were certain things, da 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 da. And this one is like, if you use electronic health records or the cert information, um, then you are. So this opened a broader net, but the enforcement is kind of, I don't know. So I would be very, very interested to see, well, what kind of things they got out here. What have they seen? What's the data? What have they found? Have there been violations? What happens? What does all of that look like? What is the additional pieces to it? It's been a year. There should be kind of an update on this particular law. I would love to see that, sir. So let's talk a little bit about, since I threw the AMA out there and all of the money that they got in the thing. Mr. Jesse shared with me a video around nurses, and we've been talking about this forever. So I'm like, are they just now hearing about this? So they were up in arms about the AMA's um, plan strategy on scope creep and how they are going after all of the people, physician assistants, nurse practitioners, pharmacists, the VA, because the VA done opened the doors wide open. Like if you a nurse practitioner, come on in. We need everybody. Come on in. They done just made it what it is and have uh, sent the AMA for a loop. Um, but the one thing I liked about the video that she sent was, medicine has changed. Like no one practiced medicine the way they did, 30, 40, 50 years ago. And so we kind of need to move with those changes. Technology is different and advancing. Why do we need to have a physician lead team to do whatever it is that needs to be done? We can definitely collaborate, um, and work with each other on these for these patients and ultimately for the patient's health. But I don't need you to be the see. I was about to say something. I don't need you to be the head in charge.
But they've been for so long.
That's what I'm saying. That's that. Like, well, that's have historically we've always done it this way. That thing. So should we always do it that way? Did Look at some of our outcomes of always doing it that way. Can we pivot to see if this way may be better? Maybe better for access, maybe better for patient outcomes, maybe better for a lot of things. Burnout, because now you have more people who can assist in caring for these patients. I mean, again, we learned a lot during COVID, and just because COVID is not the forefront and we're not in the pandemic like we were, don't let those lessons fall by the wayside.
Right.
I know, didn't he? That's why I said his whole face, his whole what he's giving me today. Like whatever. Do you got your tea over there? Where's your cup? What is happening, sir? Like something is not right.
But with this whole now, I'm going to keep it a buck. Um, this is nothing but gatekeeping, and
With the
from
nurses or the physician?
the physicians,
Mm-hmm.
and they're gatekeeping nurses. And to be quite honest, I don't have any sympathy for the nurses because they gatekeep, so they're getting a dose of their own medicine. So
All right.
let them fight it out. And all I know is the AMA is going to win in the end.
So you don't think they're going to get their full practice authority?
Absolutely. I
So
mean,
what
well,
about the states that have them?
that's fine. That'll be in the states to have them.
But you don't think it'll be something that'll be nationwide, or all
Not
states
for
will do
not
it?
for a while. Not for a while.
Because I
Because
don't see
it's
their money running out. So
exactly because what what I have learned in my later years is it is really people underestimate advocacy
that's
and
right.
people underestimate lobbying.
That's
Like
right.
this is why the the food industry, the pharma industry, that's why they spend billions in lobbying every year. Why not? Because you got to spend, or even a lot of millions. You got to spend millions to make billions, and that's what they do.
Mm-hmm. Mm-hmm.
And I don't know, I mean, I haven't seen anybody's financial records, but if I had to guesstimate about who had the deeper pockets, it's the AMA.
Mm-hmm. I would agree
And
with that.
they have their whole campaign from the beginning has been spot on. I don't know who they paid, but they have set it up.
That
And
is so mean spirited in some cases
but guess what? But what the nurses do to other
to
nurses is
others.
mean spirited.
What have
So
they done to health information? Let's talk about that.
oh, that's why health information can't get CDI jobs.
Yeah.
Oh, I can go on now though. You want to open up that can of worms?
Open it
That,
up. Open it up. We got 15 minutes. Open it up.
And
But then again, this, and again, it's not for all. It's just for those who are at the nurse practitioner level, being able to have full practice authority. But then, will that keep? I mean, some nurses will stay at the nurse level that they are. They are comfortable. They love it. It's great. Others want to advance, and others want to actually practice. So, um, at some point, for whatever reason, there comes a time in some nurses' careers where um, they're done with the bedside. They're like, absolutely not. And so then they look for these administrative jobs, and voila, we are all about the business of healthcare. We're all about the administration portion um, in health information, and they go looking. Well, actually, they've been looking for years, but yeah.
and usually also, there are a lot of not well, there are some nurse practitioners because I saw a video on TikTok. It might have been earlier this past week where nurse practitioners are going back to the bedside, and
Are they?
it's because of money. Because honestly, and especially during COVID, there were nurse practitioners who worked as nurses because they weren't making that kind of money. I mean, nurse practitioners ain't making $20,000 a week.
Mm.
At the height of the pandemic. I mean, at the height of the pandemic, there were nurses who were actually millionaires through working just like 2 years.
Wow. And that's just not travel nurses, or is that
It was travel mainly
okay?
because they were having like crazy sign-on bonuses, crazy completion bonuses. I mean, and it's just different. Like I don't know. There's a lot going on behind the scenes in healthcare, and at the end of the day, it really should be what's best for the patient and the end consumer, but it's really not. It's about money and the bottom line, and who can control the money.
Mm. Wow.
But I'm telling you, like I've been a nurse for 30 years, and I don't feel sorry for them. Let them fight the country club. They're not gonna win.
Don't cry for me.
Because if you can see, because this is what gets me all the time about people. If you can see how somebody's done you wrong, how come you can't see how the profession has done other people wrong?
Say it.
What about? I mean, what happened to self examinations? I'm supposed to cry for you, but you have gate kept an entire industry.
Like I done bullied you, and now I'm being
Exactly.
bullied. Help me, help me,
Exactly.
help me. But you don't realize the bullying that you've done, the impact of the bullying that you've done, and you still bullying those down. But you just need somebody to help you.
And also this. See, I don't knock nobody's credentials, but all I'm going to say is this: if doctors see nurse practitioners the way I see nurses in CDI, I understand why they don't want it. Because when I tell you these nurses in CDI ain't cutting the mustard, they don't know what they think they know. They just talk a good game.
I was just having this conversation with somebody um yesterday, and we were talking about, to your point, um advocacy on these professions. We were specifically talking medical coding, but something to kind of think about. So you have your AAPC, you have AHEMA, and both of them have established their lane early on. AAPC primarily professional physician led coding, and AHEMA your inpatient. Now they done cross paths, and they done mixed, and they done tried to do all kinds of things, yada yada yada. However, that was their pretty much the lanes that they initiated in and they started in. Um, and we're talking about um coders who are coming from wherever they're coming from all over the place. And so I think I personally wouldn't feel comfortable in vouching for somebody that I didn't know what they were bringing to the table, what their skills were, um, how they moved, all of the things. I couldn't say, oh, all of these coders over here, they are wonderful, they're great, stamp of approval. I would hire them. I would do whatever. I would da 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 da. Because you don't know where people got their training, where they got, you know, uh, what they got, if they got appropriate training at all. I mean, and that to your point, where how you're seeing these nurses in CDI, folks may be seeing these same things in some of these coders. Because yes, just because you took a certification exam, and we have already discussed that a lot of the folks are being, it's just like kids in school and their standardized tests. They're taught the test. They're taught the concepts of the test. They're taught, these are the things, the domains, the things that the test is going to be about. They're taught the test, not taught the skill. Um, and what is required of the skill for this profession. So as a large organization of medical coders, how can I say all these medical coders right here, or medical coders in general, cut the mustard? I mean, can you honestly say that? Unless you put kind of a caveat on it. And then even that is sort of, and I'm thinking, like, say Ahima says, well, we stand by all um, credentialed folks that have gone through our CHM accredited da 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 da, maybe. And so maybe they can vouch for, but then you got a whole slew of folks that didn't go through that. So what about them? Like, who's going to advocate for them? So it's, the more I think about it, it's messy. And at some point, folks need to think strategically about how they're going to approach this, as it relates to advocacy. Otherwise, or it's gonna still look how it's been looking for the last several decades.
Well, like this, but see, that to me goes back to gatekeeping, because if you have these standard setting organizations like AHIMA and AAPC, because I'm a nurse. When I passed my nursing boards, there was no such thing as, well, you can't get a job because you don't have 2 years experience. Like once
you
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 once
ready? You walked out. You ready?
Well, right. Once the state says, yes, you are authorized to practice nursing in this state, you should be good to get a job. But not, well, you are good to get a job. You can get a job anywhere. But in HIM, it's not like that. So you take
Well,
the
because you
time.
don't have a license either. You
But
have a certification.
right, but that's still a proof of knowledge, proof of some kind of knowledge. So and and to be honest, like their exams are rigorous. They're not no pansy type of exams. Like you really have to know your stuff because it's timed.
Hmm.
And they cover the gamut. They do a good job. Like those exams aren't, chintzy in by
Hmm.
no stretch. So
Hmm.
if that is the standard that you set and this person is able to meet that standard, why is it then you have to have experience to get a job? Why? I mean, that's all part of gatekeeping, because that's not how it's supposed to be. You have to develop people, and then
Hmm.
in that development, that's how you can tell whether this is for somebody or if it's not for somebody. I know there's everybody that has an occupational license. Everybody that has that license is not fit for it, but they have it, and through natural selection, certain people, they kind of fall by the wayside.
Hmm.
And that's just like, it should be no different in coding and HIM. You bring people in and you give them proper training, and then after a certain amount of time, either they get it or they don't. And if they don't, then you make the necessary, adjustments. But when you're allowed to have privilege based on a whole lot of things, You can the rules don't apply to you, but they might apply to me and you. It's all convoluted on the back end, and this is really what we see. Because when I tell you America as a whole has a whole bunch of mediocre mofo's running around here, a whole bunch in every profession. See,
You're right.
because the thing
You're
about
right.
it, see, for me, when I was a nurse, I could compete with any of them. You ain't going to out nurse me. When I clock in on my CDI job, you can't see me. You might be on the same level, but you ain't past me. No. Mm-mm. See, I've always had to produce. I never had that luxury of being mediocre, so
That's
I'm not.
right. That's
And it's
right.
and I see it all day, every day.
Mm,
That's the problem.
interesting. Interesting. Well, I got you riled up a little bit anyway.
Because because like people want to act like it's not a problem if people would just be honest.
Well, keep like you say, keep it a buck.
Exactly.
Keep it a buck. Say what it
I mean,
is.
that's what I like. As I'm telling you, like there was another lady who has a coding education company, and she and I talked a couple years ago, and she was like, you know, um, I honestly don't like having nurses in my class, and I understand it. And that's why I'm so effective as the coding nurse because I mainly teach nurses and I know exactly what they give. And it gives me no greater joy than to shut them the F down. Because I know how they bring it. I know how hard they come. And baby, we be battling it out. And guess who wins? Me. Because like I told him, I said, listen, I got to know this. Like you want to play around. I can see exactly it takes me 5 minutes to sniff you out.
Mm-hmm. Mm-hmm.
And either you're going to either you're going to buckle down and learn these guidelines or you're just going to step off, and sometimes people step off.
That's
that's
true.
that's fine.
That's true. That is true. So, so was she intimidated by them, or just she could just
I
couldn't?
think she was intimidated because of the challenging,
Yeah.
and I see it because I went through that with my contract last month. I saw it in both sessions. It was always somebody. And listen, if I don't know, if Jesse Armand Gallup don't know nothing else, he knows coding guidelines. And
Amen.
you not gonna catch me slipping, not me.
Amen.
And if I get caught slipping, you won't catch it. How about that?
He like I caught it. Like, wait a minute.
And when I
I
tell
did the
you,
thing.
look, and when I tell you them chicks were hot.
Oh, good
And I
Lord.
mean, because I told you, one of them ran to the deputy director, and I talked to the
Yes.
and I talked to the to the contracting officer, and I told her, I said, listen, I said their problem is they don't know what they think they know, and their ego is hurt because and they think they're going to run this train, and they're not. They don't. Do you? Does it? I don't put it out there, but does anybody? Do you know how many letters I have behind my name? And I earned every single freaking one of them. You should be lucky that I get to teach you anything. Sit down
All
and soak
right.
it up.
And again, everybody should have some level of humility when they go into any kind of class. You're there to learn something.
But when,
Why play
but,
those games?
but when because it's ego.
Mm-mm-mm.
You don't want to be wrong, but how can it be? And baby, we go right to the guidelines. There it is.
There it is. There it
Argue with
is.
the four cooperating parties, not me.
And what they say.
There you go.
That is funny. That is funny. Well, I mean, as always, it gives us some food for thought, some things to think about while we're here out here in these health information uh, streets, the nursing battles that we have to endure, um, the battles that they're enduring, and probably looking for assistance and help and navigating and managing um, the wrath of the AMA. I don't know. It's just it's interesting. It's like a It's like a documentary all in one.
It
You
really
never know
is.
what
I
you're gonna
mean,
see.
and I myself, I don't have a problem, and I have seen nurse practitioners. I don't have a problem with nurse practitioners. I don't.
Mm-hmm.
And what all they're just a victim of gatekeeping. That's really all it is. And that's how they gatekeep because they want to nitpick at what you know, your knowledge, your skill, your ability. Oh well, you don't really know as much as I know. You can't
That's
really be as
me.
good as this as me. Oh, but
And what happens to if I see if there's a way I can help you, let me help you. Let me help you be better. Or it. But it's just it's always competition.
I think it's always competition
Hmm. Do you think we have that
because
same thing even with nursing aside over in the health information profession as well?
I don't. Well, my,
Oh, here
my
we go.
honest opinion of health, of health information is I just I people don't have the skill and knowledge that they think they do, and there's nobody to really self correct because honestly, like there's not like education has really fallen by the wayside. Like continuing education, like I'll share more in the meeting after the meeting, but that this HIM requires constant education, continual education. These guidelines and things, rules change all of the time.
Every week,
And
every day.
sending out an email with with a couple of graphics and a screenshot or two, that's not education.
No, and they should have some actual examples. And
There you go.
you're in a facility. You should have some
There
examples
you go.
as you are training and educating your staff. You should. Well, yeah, that's a whole other conversation.
Because I mean that's really how I started in HIM. Like we had redacted charts
Hmm.
and they showed this is how you do this or this is an example of this. This should have been coded this way.
Yep, that's how we start. Same way. Like you got to get in there and understand, and it also leads to being able to apply the clinical knowledge that you have. It's right here. Go to your tools. Go to what you know to go to in order to figure out the information and come back and be able to explain. How did you get this? What did you do? What did you look at? What supports? Be it right or wrong, you need to go in, do the research, and determine and say, okay, based on my assessment, I got boom, and I got it this way, and da 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 da,
There you
and
go.
let the chips fall where they may. And you
Ca-
know, most folks are they're not doing that. Go ahead.
I had this one scenario, and it was actually pretty good. I got it from some job I was in. I was interviewing where I'd take a test. They only wanted the principal diagnosis, but I gave it to my students every year as one of their weekly questions. Nobody got it right for 3 years. They always coded it wrong, and so I will always offer a gift card if somebody got it right.
Mm,
Last year was the first year somebody got it right,
wow.
and she got $100 Target gift card. But and these are all nurses, and that's where multiple choice does a disservice. Now, I understand for an exam, you
Mm-hmm.
have to have multiple choice, but I really think this goes back to if the HIM industry could do anything, what they need to do, they need to take multiple choice questions out of the education. And I know why they do it because they want to get you conditioned to, for the exam. But
And I
that's
don't
not
have
how you
multiple
learn.
choice questions. I have um you have to find the information. You have to you're coding it. Here's a case, you need to code it. The only time I have any multiple choice is when like my midterm. So it's kind of structured, so and it's timed. So it's structured so you can feel what the actual standardized coding exams are. And then my final is the same way. It's structured. But all of the assessments and all of, because I'll tell you off the top, you're not ready. You need some more. This is your area of weakness. Let's find some more examples that you need to code to understand. Either you're not understanding the guidelines, or you're not understanding the conventions of the book, or you're not understanding the clinical protocols related to stuff. Something one of the three is off.
Now, my final is multiple choice, but
Mm-hmm.
and the only multiple choice that I have on my on and during my training is when we get into the prospective payment system. Like, I'll give you like which one is an HCC, which one is the CC, which one of these conditions is going to affect the DRG the most. Those are multiple choice,
Yeah, and that
but
kind of stuff.
right.
Even like compliance information and the history of Medicare and all of that kind of stuff. Yeah, you can do that, but for the skill of
Oh
coding,
yeah, yeah,
you
yeah.
need to code. You need to code. Process of elimination, all of that, wonderful on a timed exam. Real
Right.
life, absolutely not. Ain't no elimination. There's nothing that you're getting. You have to be the one to put the choices out there. Code
When
be the choice maker.
when you're reading that note and you get down to the assessment, it's not multiple choice,
It's not. It is absolutely not.
and you have to know
If you
that's
sitting there like a deer in the headlights, you got a problem.
exactly. Look,
You got a problem.
you've been done a disservice.
You've been done a disservice, which then makes the whole lot look bad. That's where I'm like, how do we can't say the world, Craig. We can't say the world.
But I'm telling you, like in the whole CDI, like how they frame the whole, getting back to that whole, how they have given these nurses this lofty attitude is, well, we're not coders, but that's not my job. If it is your job to assign a diagnostic related group, then ma'am, sir, you are a coder. Point
Wow.
blank. But
Wow.
that somehow feels as though they feel as though they're absolved because if that's not my job. And truthfully, and it's just like I said earlier, and I had a conversation with somebody else, is that even with the contracting officer, that they think that they're above coding, and they think they're above it because they don't know how to do it. And
Mm-hmm.
rather than humble themselves to take the time to learn it, oh, that's not my job. Well, that's for them to do. But meanwhile, you out
Yes,
here,
that's something else. That's
right? But meanwhile, you out here messing up the church's money.
yes, Lord. Yes, Lord. All right. Well, with that, we are at the top of the hour. Woo, look how time flies when you are having fun. Was the tea spilled today? Yes, in more ways than one, huh? In more ways than one. So, before we get out of here,
Oh, one more thing.
yes.
Carolyn, I see your question. She said, "Can you share that question in the meeting after the meeting?" I'll find it, and if it's not this week, it'll be next week. I think I can pull it up real quick.
Well, that is a perfect segue to our Patreon. And so, did you know by becoming a Patreon of ours or a member of our Patreon, the Tea Sippers, you're joining a community of individuals who share a deep appreciation for the intricacies of healthcare revenue cycle. Here's what you can expect as a valued tea sipper or member of our Patreon. Exclusive healthcare insights. So you gain access to in depth articles, webinars, class notes, questions and tests, all of the things, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. You also get early access, so be the first to receive expert insights and guides, ensuring you stay ahead in the ever evolving healthcare industry, as well as personalized support. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth. Community connection. Join a private community of healthcare professionals where you can network, share experiences, and collaborate to find solutions to common challenges. So, by supporting us on Patreon, you're not only advancing your healthcare knowledge and career, but also contributing to the success of the group as a whole. And as a resource, we empower healthcare professionals like you to thrive in their roles, all for the mere cost of, what is it, a Starbucks or something? I don't know. Somebody said that for, like, for the cost of Starbucks. I done gained so much information and insight. I probably need to be putting the social proof, if you will, from those who are actually members. So, thank you so much for considering becoming a Patreon. Check out the link in the description of the video, or you can go to patreon.com/Clarice Warner, the girl with the pearls. And we look forward to helping you excel in the world of health information. So, with that being said, and us at the top of the hour, because we'll be sliding right on into our meeting after the meeting, and that's one of the other values of becoming a Patreon is the wonderful discussions that happen in the meeting after after the meeting. But if the tea was spilled today, please make sure that you put your teacups in the comments. Let us know that the tea was spilled. Um, And if this information was valuable for you, help us share this message with others by sharing the video and subscribing to our channel. We can't do it all. We can't do it all. But with you, we can do so much. And so we appreciate you being here. We appreciate you sharing the information, letting folks know we are out here all about the business, keeping it, as Mr. Jesse say, a buck. um, Also, um, subscribe to the channel. We provide additional information, not only our weekly Saturday morning tea, but we also have additional information about things that are coming down the pipeline for health information professionals. We talk about things related to compliance, revenue cycle, and of course, medical coding. So as you leave out, don't forget to hit the thumbs up or like button. And also check out Mr. Jesse's The Coding Nurse channel on YouTube as well, where he out here send it, and I guess his Instagram, because he out here just, all of the videos are just, they were hitting last week. Boom, 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 left and right, left and right. I said, I'm getting pinged all day long. I'm saying, well, Mr. Jesse is out here working in these streets. So this has been a great session today. Mr. Jesse, do you have any final comments or any final thoughts?
No, great episode as always. Looking forward to the meeting after the meeting and more Saturday morning teas.
Yes. All right. So see you tea sippers at 10:15 a.m. Thank you all for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and have a wonderful weekend.